Hi, everyone. Good afternoon, and welcome to Corporate Insights webinar on our Health Plan Experience Benchmark and Consumer Survey. I am Stephanie Chan, a senior analyst on the healthcare research team, and I am joined today by my colleague Tess Martin. We will be going over high-level findings from our annual benchmark study and also our 2024 consumer survey. Very shortly, we will get into exactly what these benchmarks are, but they basically provide an objective, unbiased assessment of health insurer digital platforms. There will be time for Q&A at the end of today's session, so feel free to leave your questions in the chat. And everyone here will receive a copy of the recording and the presentation afterwards. So here's our agenda for today. We will start with a quick introduction to corporate insight, followed by our research methodology for the benchmark. Then we'll move into some high-level findings from the website and mobile benchmarks, along with some industry trends and a preview of a specific category. Then Tess will take it over, and she will walk through findings from our consumer survey. So Corporate Insight is a competitive intelligence and consulting firm based in New York City. We provide competitive intelligence on the customer experience, and we really do that by becoming the customers ourselves. At the firms we track across 21 verticals, which includes health insurance, banks, fintech, and so on. We help clients shape their digital strategies, and we answer fundamental questions like, what are your competitors doing? And how do their products stack up to the competition? So with that, we'll get started with the experience benchmark. As I mentioned earlier, these benchmarks provide an objective, unbiased assessment of health insurer platforms. This includes both the website and the mobile app experience. Our research tends to track both the public and member site experiences, also known as pre-login or post-login experiences. But in these benchmarks, we are focusing on the post-login experience, so that end experience for a user. These benchmarks help you compare your platform to competitors and understand the broader competitive landscape. They help identify your platform's strengths and weaknesses and offer screenshots from top competitors in different areas. This helps our clients support and drive their digital roadmaps. So our first health plan experience benchmark was released in September 2024, and we plan to conduct these studies on an annual basis moving forward. So this slide here shows the framework for our benchmark. It consists of 8 categories, which you can see at the top here in the blue boxes. So the 8 categories are coverage and health information, claims, digital care tools, prescriptions and pharmacy, health and wellness resources, support, profile and settings, and lastly, design and navigation. So each category is split into several subcategories, which you can see on the slide here. And then each subcategory then has multiple attributes. So our benchmark has over 120 attributes, which lends to a rigorous and comprehensive assessment of each firm. You may also notice that some of these subcategories are called ease of use. Here we conducted expert reviews of common actions that a user may take on their health insurance account. So for example, interacting with the live chat tool, looking for EOB statements, or finding ID cards. Our benchmark attributes evaluate the functionality, design, navigation, and usability of health insurance platforms. So this includes both web and mobile. We review and compare different digital experiences, and we do that by assigning grades of poor, fair, good, or excellent to each attribute. These grades then culminate in scores from 1 to 100 for each category and the overall experience. So to the right here, you can see the 4 classification groups that we have created based on these numeric scores. So the 4 groups are leading, achieving, effective, and trailing. So firms in the leading class tend to offer advanced capabilities, innovative features, and robust ease of use, while firms in the trailing class have significant room for improvement when it comes to functionality, design, or usability. Every year, Corporate Insight also conducts a large-scale health plan consumer survey, and this allows us to gain valuable insights into the digital preferences and behaviors of health insurance members. So we conducted this survey in June of 2024, and we obtained responses from over 900 individuals. Our survey respondents were required to be at least 18 years old, have health insurance, and have logged in to their insurer's account, whether on desktop or mobile, in the last 6 months. In our survey, we asked users to rate the importance of various health insurance platform features and their usage of those features. And based on those results, we assign importance weights to all aspects of the benchmark framework. So on the right here, you can see the category weights that we apply to the website and the mobile benchmarks. We see that for both platforms, the two most important and most heavily weighted categories are claims and coverage and health information at 20% each. And then we observe some slight variance in the other categories. So for example, digital care tools has a weight of 15% for the website benchmark, but is at 12% for mobile. Again, our grading is an objective, unbiased assessment. So these category weights simply influence the makeup of the overall score that a firm receives, but our grading is not based on consumer sentiments. This slide here shows our coverage set for the benchmark. We evaluated 23 of the nation's leading health insurers. Our benchmark focuses on the commercial health plan experience, and most of these accounts were employer-based accounts. So with that, we can get started with findings from the website benchmark. We see that only one firm, United Healthcare, reaches our leading status with a score of 82 out of 100. After that, we have Aetna and Anthem BCBS tying for second with scores of 78, and then Cigna and Wellmark tying for fourth with scores of 76. The competitive set average is a 67 out of 100, which reviews an industry with room for improvement. We see that the mass majority of firms do place in the achieving tier, which is a score of 60 to 79. We also observe considerable clustering in the mid-range. So several firms earn identical scores of 62, 64, and 68. That suggests a competitive middle ground where multiple firms offer similar levels of features and functionality. A positive finding for the industry is that no insurer scores in the trailing tier. That's a score below 40. And this suggests a baseline level of digital competence across the evaluated firms. Here we have a snapshot of United Healthcare, which ranked first for the website benchmark. So on the right in the bar graphs, you can see United Healthcare's score in each category, which is represented in the blue bars. And then the industry average is represented in the orange bars. To the far right on the rank column, you can see United Healthcare's rank in each category. So we see that it lands in the top 5 for all categories except for 2. Those 2 are prescriptions and pharmacy, and health and wellness resources, where United Healthcare comes in 8th place for both. We see that United Healthcare places first in claims. It offers unique features like saving claims, leaving notes, and marking claims as paid. It also ranks first in digital care tools. So last year, United Healthcare introduced newly redesigned provider search and cost estimator tools that lend it to its strong performance here. And it also comes in first in the support category. So on its member site, it offers ample FAQs, personalized plan videos, and a robust chat tool. A trend that we're seeing in the health insurance space is an increased focus on site design, navigation, and support resources. So our research shows that there is an uptick in insurers introducing dedicated EOB centers, which help centralize the location of these statements, and also alerts or notification centers, which draw member attention to timely details. We also see a focus on design. So in early 2024, Horizon Blue and Independence Blue Cross revamped their member sites to feature modernized designs. And then over the summer, we saw that Aetna and United Healthcare added site search tools to their member sites. Our research also shows that chat tools are continuing to grow in popularity, and some unique features here are that Anthem BCBS and Kaiser Permanente members can connect with a pharmacist through the live chat. Our research also shows that Aetna added a live chat tool to its member site just a few months ago in the fall. So here I have a question for everyone before we move on to findings from the mobile benchmark. I'm curious how you think mobile apps performed compared to websites. Do you think mobile apps earned higher scores, lower scores, or do you think they scored about the same? I will leave this question up for just a few minutes for everyone to put in their responses. Cool. So looking at these responses from everyone here, it seems like the vast majority of you think that mobile apps earn lower scores, which is correct. So our mobile benchmark shows that mobile apps score generally lower than websites. So the competitive set average is a 57. That is exactly 10 points lower than our website average of 67. For our mobile benchmark, no insurer scores in the leading tier. So our highest ranked firm is Anthem BCBS with a score of 77. After that, we have United Healthcare in second, Wellmark in third, and Independence Blue Cross in fourth. We see that only about half of the firms score in the achieving tier, which is marked by the blue on the graph here, and a good handful of them fall in the effective tier, so a score of 40 to 59. This is in contrast to our website benchmark, where most of the firms were in the achieving tier. Here we have a snapshot of Anthem BCBS as they were the highest ranked firm in the mobile benchmark. So again, in the bar graphs on the right, Anthem's score is in the blue and the industry average is the orange. So Anthem earns top 5 finishes in all categories except for 2. Those 2 are design and navigation and health and wellness resources. We see that Anthem ranks first in profile and settings, and this is due to its wide range of communication preferences and profile management options. It also places first in support. It offers a robust Sydney chat tool and an equally robust message center. Anthem comes in second for digital care tools. It offers a well-designed and functional care and cost tool, as well as notable telehealth services. And it also comes in second in claims. It offers a dedicated EOB center, which we know is growing in popularity. Here we wanted to highlight some unique mobile device features that would boost convenience for mobile app users. And one area that we're seeing these in is in ID cards. So about half of the firms in our coverage set allow members to add their ID cards to digital wallets like Apple Wallet. This would be highly convenient for users who are already using these digital wallets to store card information for other features such as credit cards. We see that Highmark BCBS members can report their ID card as lost or stolen, while Kaiser Permanente includes a QR code that members can use at in-network facilities. Lastly, United Healthcare members can access ID cards without signing in to the app. So this is quite helpful for users who do not want to deal with the hassle of logging into their account and then looking for ID cards. Their ID cards are readily available from the landing screen of the app. Another area that we observe innovation in for mobile apps is through the provider search tool. So at Anthem BCBS, from the results, members can save provider details into their device's contact list. So it automatically pulls in the name and the phone number of a doctor into the phone. Anthem members can also share provider results through iPhone sharing capabilities like AirDrop. Now we'll be going over results from a specific category in our benchmark. So here we are looking at the claims category of the mobile benchmark, which consists of 4 subcategories. claim data, EOBs, claim functions, which refers to paying and submitting claims online, and our ease of use journey. So here we evaluated the findability and usability of EOB statements. So from our survey, we found that about half of the respondents have viewed claims on their insurer's mobile app in the last 6 months. This was the most performed activity from our survey. But despite this high importance and usage, the average score for this category is just a 56 out of 100. This is also lower than all the other categories that we're seeing in our mobile benchmark. And we also observe particularly wide variance in scores. So the lowest ranked firm earns a score of 16, while the highest ranked firm, which is United Healthcare, earns a score of 85. We see that United Healthcare is joined by 2 other firms in the leading class. This is Anthem and Wellmark, which tie for second. After that, we have Aetna and Care First, which tie for 4th place in this mobile claims category. Now we'll walk through some best practices from specific subcategories. So here we are calling out best-in-class examples of firms for each subcategory. So starting with the claim data subcategory, which goes over claim listings, claim history, we see that United Healthcare and Care First emerge as best practices. They offer well-organized mobile apps with ample pieces of information, filters and sorting options, and visualizations. Uniquely, United Healthcare members can leave notes about each claim, they can mark it as paid, and they can also save the claim. And then as for Care First, it stands out for including a search bar so members can quickly find a specific claim, and it also offers an interactive support tour of the claims section. As for EOBs, we recommend looking to Aetna and Anthem for best practices. So both offer well-designed and detailed EOBs within dedicated centers, which again, we know is growing in popularity among insurers. Aetna additionally has summary screens, and these include colorful donut graphs that visualize the cost breakdown. They also include claim details, plan balances, and FAQs. And you can see that from the screenshots on the left. And as for Anthem, it offers dedicated centers for each benefit type. So for example, medical or dental. And it also offers filters and a search bar specific to the EOB center. And that is reflected in the 2 screenshots to the right here. So before we conclude this first half of the webinar on the benchmark, here's a preview of the attribute level recommendations that we offer in these custom benchmarks. So here we are looking at the mobile support category and specifically the findability attribute of our ease of use journey. So here we are evaluating the process of interacting with a live chat tool. So in our custom benchmarks, we first describe the user experience of your firm. So for example, what steps a user would have to take to reach the live chat tool. Then we describe any pain points or challenges that users may face because of the findability of the chat tool. And so to help improve the user experience, we offer best practices and recommendations from firms that offer a seamless journey or earn excellent ratings in the area that your experience can be improved on. So with that, I'm going to pass it over to Tess, who will now walk through findings from our consumer survey.
Great. So to support the findings from the experience benchmark, we conducted a consumer report in June of 2024 with over 900 web and mobile respondents. To qualify for the study, participants had to be over 18 years old, have a health insurance plan, and have accessed their insurer's member account on either the desktop or mobile app in the past 6 months. We refer to respondents who primarily used the desktop website as our web respondents, and those who use the mobile app as our mobile respondents. Of our 900 respondents, we achieved a near 50-50 split of web and mobile users. Select survey questions asked users to indicate levels of importance or satisfaction on a 5-point scale, with the options being not at all important, slightly important, moderately important, very important, and extremely important. When analyzing results, we primarily focus on the sum of responses in the top two boxes, referring to the number of responses in the very important and extremely important categories. Throughout our survey analysis, we will refer to this as top two box importance, and we used a similar 5-point scale to determine user satisfaction. So we looked at 3 factors among respondents when considering data and trends: age, gender, and insurance type. We grouped our web and mobile participants into 3 generational cohorts. So we combined Gen Z and millennial respondents into one age group, as well as baby boomers and the silent generation users into another. We separated out Gen X respondents for our 3rd age cohort. We also separated insurance types into 3 categories, which were Medicare, employer, and individual. On the right here, you can see a breakdown of web respondent demographics. And as you can see, boomers were the largest sample size by age at about 50%, followed by a fairly even split of millennial and Gen X users, with each of these cohorts making up around 25% of participants. Female respondents slightly outnumbered our male respondents, and there was a similar number of participants with Medicare and employer insurance plans, and fewer respondents with individual health plans. The mobile demographic breakdown followed similar patterns, with the main difference being a larger percentage of millennial and Gen Z users compared to web. However, boomers were still the largest cohort by age amongst mobile respondents. Our survey shows that login frequency remains higher on mobile apps than desktops, with 18% of mobile respondents signing into their insurer's app once a week, compared to just 10% of web respondents who do so. Continuing this trend, 34% of mobile respondents log into their mobile app multiple times per month, in contrast to just 22% of web respondents. We conducted a similar survey in 2023, and we see that these trends hold true year over year. This goes to show the importance of mobile apps in the health insurance industry and the need to have well-designed, easily navigable apps for on-the-go usage. We asked users to rate their satisfaction with their insurer's member site on a 5-point scale, from extremely dissatisfied to extremely satisfied. We found that satisfaction rates were high across both platforms, with 82% of web and 89% of mobile respondents being somewhat or extremely satisfied. Millennial and Gen Z respondents reported the highest satisfaction levels for both web and mobile, at 87% and 90% top 2 box responses, respectively. Boomers and Gen Xers trailed not too far behind, and their satisfaction levels were still relatively high. And you can see that in the graphs here, where the left is for the web respondents and the right for mobile. And the navy color represents the percentage of users who marked feeling somewhat or extremely satisfied. Here, the lighter blue represents respondents who were neither satisfied nor dissatisfied, and the orange represents the small percentage of users that were somewhat or extremely dissatisfied. We also asked users about the importance of their insurer's member site and specific digital features that aligned with our experience benchmark categories. About 2/3 of web participants considered their insurer's site very important or extremely important. Notably, mobile respondents reported higher top 2 box importance, with 77% of mobile users believing their insurer's mobile app is very important or extremely important. We also asked respondents' opinions on the importance of 8 digital features that comprise the experience benchmark categories. and web and mobile respondents valued the same three features the most, those being coverage and health information, prescriptions in pharmacy, and claims. You can see the similarities in importance rankings across platforms displayed in the table to the right, where the navy represents web respondents and the light blue mobile. We see that the mobile app users placed the same amount, if not more, importance on these categories than website users. The largest difference between platforms is the support and health and wellness resources categories, where mobile app users rate these features to be 9 and 8 points respectively higher than website users. In the survey, participants were shown a list of different actions they could complete on their health insurer's account, and we asked them to mark which of these actions they had performed in the past 6 months. We see alignment between web and mobile users on their most common activities, with the top 4 being viewing claims history or details, refilling prescriptions, viewing coverage and benefits, and viewing prescription history. Notably, of the 10 most popular activities shown in the bar graph here, 7 fall within the coverage and health information, prescriptions in pharmacy, and claims categories. We see that mobile activity surpasses web activity in certain areas, with a notable one related to ID cards. Here, 30% of users viewed or requested an ID card in the past 6 months on the mobile app, compared to only 19% of web users. Our survey shows that millennials and Gen Zers consistently demonstrate higher engagement across all 8 benchmark categories compared to their older counterparts, which you can see in the bar graph here, where boomers are represented by the navy color, Gen Xers in the light blue, and millennials and Gen Z in gray. The most pronounced generational gap observed is in the use of digital care tools, which we use here to refer to provider search tools, cost estimators, and telehealth resources. For example, 55% of millennials and Gen Zers use provider search tools, and 42% use cost estimators, compared to only 29% and 13% of boomers, respectively, which is shown in the table on the right hand of this slide. We also observed a year-over-year increase in the use of provider search and cost estimator tools among our younger members, with usage rising by 20% and 8% respectively. This suggests that younger members' high digital comfort levels and preference for self-servicing features signals a shift towards more digitally driven healthcare decisions. So that concludes our webinar today on the Health Plan Experience Benchmark and findings from our consumer survey. On a high level, we see that benchmark leaders excel in key health insurance digital aspects, such as coverage, claims, and digital care tools. The top performers are generally the same for both website and mobile benchmarks, suggesting that they offer robust cross-platform experiences. On average, the industry performs better in the web benchmark than the mobile benchmark, with no insurer reaching the leading tier for mobile. That suggests there is ample room for improvement for the industry as a whole. On the survey side, while mobile apps generally received lower grades in our benchmark, consumer sentiments indicate they're actually more important and more frequently used than their desktop counterparts. This disparity outlines a point of improvement for firms looking to satisfy their app users who place high value on insurers' mobile platforms. Additionally, our survey found that younger generations are more engaged with their insurers' digital platforms, with higher activity levels than older generations across all 8 of our benchmark categories. So with that, we will now transition to the Q&A portion of the webinar, and you can put any questions you may have in the chat.
Yep, we'll be answering some questions now before we wrap up. So someone has asked, where does finding a network provider and cost transparency fall in these categories? So looking up a provider and looking for costs falls in the digital care tools category of the benchmark. Someone has asked, overall, mobile apps scored lower than websites, but are there any firms that had a higher mobile app score than their web score? So that's a good question. We see that some firms have earned exactly the same score for both web and mobile, and some had web scores that were about only 1 point or 2 points higher than mobile, but there was no firm in our benchmark that performed better on mobile than on web. You mentioned that there are grades of poor to excellent in the benchmark, but then there are also numeric scores. Can you go over the scoring again? Yes. So for each attribute in the benchmark, and we have over 120, we assign grades of poor, fair, good, or excellent. And then these then culminate into the numeric score of 1 to 100 for each category and the overall experience. So the poor to excellent grades are on the granular attribute level, and then the numeric scores are on the bigger scale. Yes, there will be a copy of the presentation and the recording that will be sent out shortly after this. Someone has asked, did you analyze competitor use of AI within their experience? So in our benchmarks, we did look at virtual assistants and live chat tools, but other than that, we did not look specifically at AI mechanisms or tools that they could be using beyond that. Did you weigh certain functionality more than others based on engagement ratings? So yes, we do have different weights for each of the category. So the two most important categories and the most heavily weighed ones were claims and coverage and benefits. And then other categories such as support, profile and settings, health and wellness resources, these were weighed less. How was this information captured? And was it for a specific type of insurance product? So this health plan experience benchmark focuses on the commercial experience. So most of the accounts that we evaluated were employer-based accounts, and then there were a few individual or family accounts here and there. This benchmark does not look at the Medicare experience, but in our survey, we did survey Medicare respondents just to have a better understanding of all generations, but the benchmark itself does not look at Medicare. And then one more question, did you observe any generational differences in login frequency for web and mobile? So that's a good question. And earlier in our webinar, we had mentioned that users overall log in more often to their insurer's mobile app than the website. And looking at specific generations, we actually see that all of our age groups, so boomers, Gen X, and the combined millennial and Gen Z group, they all log in more frequently on mobile apps than web. Great. So here's our contact information. You can feel free to reach out to us with questions on the benchmark. I know there have been questions about how to get access to the detailed findings. Feel free to contact us here. Thank you everyone for attending, and I hope you have a great rest of your day.